Good morning, everyone, and welcome to Eastside High School for the ribbon cutting of St. James Health's new health center in partnership with RWJBarnabas Health. I'm Nicole Fields. I'm the Chief Executive Officer of St. James Health, and I want to start by welcoming some of our elected officials, our speakers, and distinguished guests. I'll start with the elected officials. We have New Jersey Senate Majority Leader Teresa Ruiz here. New Jersey Assembly Budget Chair Eliana Pintor-Marin. The Mayor of the great city of Newark, Honorable Mayor Ras Baraka. Just walked in, we have Council President LaMonica MacGyver. Our other guests, we have Mark Manigan, the President and Chief Executive Officer of RWJBarnabas Health. Roger Leone, the Superintendent of Newark Public Schools. Joseph Palm, the Regional Director of the U.S. Department of Health and Human Services, Region 2 and 7. We have Dennis Gonzalez, the Executive Officer from the U.S. Department of Health and Human Services, Region 2. Nation Hornsby, Assistant Commissioner, New Jersey Department of Health and Human Services, New Jersey Department of Health, Division of Community Health Services. Damon Kozlow, the Manager, Office of Primary Care and Rural Health. Ketlin Baptiste Alsbrook, Director, Newark Department of Health and Community Wellness. And Balpreet Grewal Virak, Senior Vice President, Community Health at RWJBarnabas Health. As I look around, as always, I see all of our community groups that support us day in and day out. There's always too many of you to mention, as we learned last time. You guys just keep pouring in, and we can't thank you enough for the support you give us every single day. We also have some of our board members here. I see our board member, Renata Diaz. And along with our board, I'd like to welcome you all today. So we're extremely lucky with the timing of this ribbon cutting. It falls during National Health Center Week, which is the annual celebration raising awareness about the mission and accomplishments of America's federally qualified health centers. In New Jersey, the FQHCs serve over 574,000 patients annually. And this number continues to grow along with the demand for affordable health care. So it's an honor to celebrate the opening of this new site with all of you during this week. In 2016, St. James opened its first health center here in the Ironbound neighborhood of Newark. And here we are again, back here 8 years later, opening our fourth location. This location is extremely special to both me and to St. James Health because it's in Eastside High School. Our partnership with Newark Public Schools, and specifically Eastside High School, goes back to the day we opened. This school is one of the pillars of the community, and in 2020, when we needed help getting mass vaccine sites up and running, this was the first place we came. This was our first mass vaccine site to open and our last one to close. The buy-in from the staff here, from top to bottom, is what I attribute that really high vaccination rate of the 07105 zip code to. They were here every day to help us and gave us anything we needed to make sure we were able to vaccinate this community. I also know that this specific health center in that exact space has been a dream of the principal, Carlos Gonzalez, for many years, but way before he was principal. I think he showed me the site probably 8 years ago. We also would not be here today opening the site if it wasn't for our partnership with RWJBarnabas Health. In the past 2 years, the partnership has grown to help us better serve the community. A few months ago, we all came together to celebrate the ribbon cutting of our 340B pharmacy and our food pharmacy at our Lafayette Street location. But there really has been a lot going on behind the scenes as well. We have gone on to RWJBarnabas Health's medical record system, which was a huge undertaking, but it really does provide our patients with much better care. We're able to send our patients to all RWJBarnabas doctors and then have our medical records at their hand, and vice versa too. When we make a referral and the patient comes back in, our doctors can see all their medical records, and it provides much better quality care. We also have a partnership with the Community Health Worker Program, where RWJBarnabas Health's community health workers are based in our health center locations and assist our patients and case managers not only with referrals, but social determinant needs. And we have started rotating RWJBarnabas specialists through our sites. We have extremely high no-show rates when we send our patients out for referrals. So to try to close that gap and have our patients actually go for their referrals, the specialists are going to start coming to them in our facilities. We've started with a few services, and we're going to keep expanding that as we expand the sites. So as always, I'm so thankful for this relationship. I can go on and on about our partnership with RWJ and how every single person sitting in this front row, and really the rest of the room, supports our mission. But we have a long program with people that represent our partners, as well as city, state, and federal officials. So I'll introduce our first speaker, the Superintendent of Newark Public Schools, Roger Leone.
Good morning. Joining me is President Hassani Council of the Newark Board of Education and board member Elena Vinhas. So thank you for being here with us. It comes to me as no surprise that we are here at Eastside High School. Imagine just for a moment the second gentleman of these United States, the Secretary of Education, Governor, Mayor, Senator Ruiz, and Assemblywoman Pintor in this very school, in this very space, because of one important moment, all convened here as a collective effort spearheaded by the mayor and the city of Newark and the school district, which I have the honor in leading. It came to us, both the mayor and I, as no surprise that we would combine efforts and energy and resources to address the impact of an experience that he nor I and most of the people, if not all in this room, have ever lived with the global pandemic. In Newark, we are at our best in moments of crisis. Imagine, if you will, that at the center of our collective efforts, in the crisis of our lives, we both were benefited with the opportunity of having amongst us Nicole Fields as our angel. This room, thousands of Newark residents, for the most part, were here, in fact, receiving their vaccines. Literally, I received mine a couple of feet from here. At St. James Health, just a couple of blocks away, this young lady, and I know her dad is extremely proud of her always and today, opened up the doors every hour of every day, not only to the residents of the city, but to me, to my executive team, to my principals, and my entire staff, and we are grateful to you. Carlos Rodriguez is our incredible principal here at Eastside High School, and he's a leader who is modeling for everyone what work and efforts all of our school leaders do. So in partnership with St. James, he and the principals in the East Ward opened up the doors of Eastside High School, not only to our students and their families, the East Ward completely, and our residents here in Newark. We, the Newark Public Schools, are indebted to our partner, RWJBarnabas Health, who is working with us at Weequahic High School with our Allied Health Services program. Dr. Loisy, our Director of Health, Kellen, the Director of Health for the City of Newark, and the entire Newark Health Department. We are grateful to them. And finally, my classmate graduated with me from Science High School, Raul Malave, who partners with Nicole Fields on this project. So I knew we were bound for greatness. Congratulations, and we know our community is better because of you. Thank you.
I'm surprised we didn't have to hear about the debate team and how many awards you won as well. No, you can. Our next speaker is the person that came to me 2 years ago, maybe 3 years ago, about partnering with RWJ-Barnabas Health, the President and Chief Executive Officer, Mark Mannigan.
Good morning. I'm incredibly proud to be here on behalf of my 41,000 terrific colleagues at RWJ-Barnabas Health. And I remember that day, Nicole, when I came to see you, and we talked about what the city really needed in terms of community health. And there was immediate alignment around those needs and solutions to address the problems at hand. But before I get into that and brag more about Nicole and all the incredible work she's done, I'm so proud of her and her dad and what they've done for the city. I just want to acknowledge a few people who, without whom we wouldn't be here today. Of course, Superintendent Leon, thank you for your leadership and vision. Mayor Baraka, man, I'll tell you, is a terrific mayor. He's been a terrific partner. And when folks look back on that which we've been doing here for the last couple of years, they will judge us by how we treated the most vulnerable among us. And Mayor, they will judge you well. Thank you for your leadership there. Senator Ruiz and Assemblywoman Pinter Marin. These are two leaders whose passion and commitment to the people of this city give hope and inspiration to us all. We would not be here today without their leadership in Trenton and the funding that was generated by their blood, sweat, and tears. Thank you so much. City Council President McIver, I can't wait for you to go to D.C. and tell all the people down there the good we're doing here so you can get us more money so we can do more of this. Thank you so much. Congratulations to you. Joe Palm and Dennis Gonzalez from the U.S. Department of Health and Human Services, thank you. We view you all as partners together in all this. Ketlin Baptiste Alsbrook, the director of the Newark Department of Community Health. And I would also want to acknowledge Nicole's partner in crime here, Balpreet, our Senior Vice President of Community Health, who has, with Nicole, brought all this incredible progress to life. And thank you, Balpreet. You know, I often talk about how the work we do at the health system, caring for the sick and injured, is inherently noble. And I think sometimes society takes for granted that there are tens of thousands of people who have dedicated themselves to taking care of others and the sick and the injured. I would also assert that educating our youth and providing a forum, a safe haven, and developing our youth into the leaders of tomorrow and to adults is also inherently noble work. And we are proud to partner with St. James and proud to partner with the Newark school system to care not only for the students of this terrific high school, but their families and the Ironbound community writ large. At RWJ-Barnabas Health, our focus has been for a long time, before it was chic, our focus has been beyond traditional health care. Because as we all know, 80% of one's health condition is determined by where you live and with the conditions under which you live, a good job, access to healthy food, access to primary care, preventative medicine. That's why we've developed our Anchor Mission program, where we hire local and we buy local. That's why we've supported housing for the homeless, the Hope Village, the brilliant work that Mayor Baraka is leading. That's why we partnered with St. James Health on expanding preventative and community health in facilities just like the one we're celebrating today. This facility, like that we do throughout our partnership with St. James Health, will provide not only access to care, but coordinate health care, coordinate follow-up, and coordinate access to other social services. There's a lot available in cities like this. The challenge has been tying it all together, and that's what St. James Health is doing. And when it comes to the health of children and young adults in New Jersey, particularly those in Newark, I'm really proud of what we've done here. RWJ Barnabas Health, we built a greenhouse in Newark that grows 5,000 pounds of fresh fruit and distributes it annually. We've distributed 40,000 pounds of fresh farm food meals through our Common Market Farm Box program, 29,000 farm fresh food meals to school children. We've distributed tens of thousands, if not hundreds of thousands, of diapers to those in need through our Newark Beth Israel Medical Center Women's Pantry. We're funding local community gardens. We're funding and we're hosting farmer markets where local produce and rural produce is delivered to the community. We educate families, over 4,000 families, on nutrition and education around nutrition and nutrition counseling. And today we're distributing 1,000 backpacks to make sure our students in this community have the tools they need to be successful. And we've learned, again, from our deep roots in the community about the social determinants of health, and we're exceedingly proud of our commitment to the most vulnerable, a commitment we share with all of you. RWJ Barnabas Health is the largest provider of charity care to the state of New Jersey. We are the largest provider of care to beneficiaries of the Medicaid program in the state of New Jersey by 2 times. With our partners in government here today, we are an essential part of the safety net of this state, and we're very proud of that. We are deeply committed to the city of Newark. We love Newark and the folks who live here. The work going on here with St. James Health, our partners in government, the Newark school system, are examples and expressions of that love and commitment. We are in and of this city, RWJ Barnabas Health. We live here, we work here, we play here, we invest here, we hire here, we buy here. We've been here for 130 years, and we'll be here for the next 130 years. Thank you very much. Congratulations again, Nicole.
Thank you so much, Mark. Our partnership with the City of Newark goes deep, and during COVID, the next speaker never said no to us. When I told him we wanted to vaccinate at bus stops, he told me, knock myself out. When I told him we had to test on street corners, he said, go for it. The mayor's leadership in the city through the pandemic was like nothing we ever saw before, and it really brought everybody together. We had a collaboration like we never saw before, and we want to continue that collaboration after. So I want to introduce the Honorable Mayor Ras Baraka.
Thank you. Good morning. Good morning. Seems like this is a habit now. We be here with RWJ Barnabas, Nicole, Ketlin, all of us together. Obviously, thank our Senator, Assemblywoman, Roger Leone, the superintendent here, our council president. I didn't see her, there she is in the front. There you go. All of you folks that are here, we're doing this over and over and over again. And Mark and Nicole talked about the social determinants of health, the things that keep some people on the planet longer than others, how neighborhoods are completely different because their access to health care, to food, to housing, also is why some neighborhoods and communities are more expensive than others, and why people don't have access to quality opportunity. Health care is incredibly important. The relationship that Nicole has with RWJ Barnabas, that has with the health department of the city of Newark and the state, this private-public relationship is incredible. It's not competition, it's collaboration. I can speak a couple of years ago when there was constant competition and me fighting and pushing and forcing people to sit in a room together and do things collectively. This is not the case in the present sense, and as a result, you see all of the clinics popping up all over the city of Newark, which is incredibly important. Affordable health care that's accessible to all of our residents is exactly what we need. When I was a principal at Central High School, we had a clinic and a daycare center in the basement. I couldn't tell you how that improved attendance, improved, the kids' opportunity to get access to health care, for them to get access to daycare. All of that was right at the fingertips of parents and students. So this clinic at the school is tremendously important and a brilliant idea at the same time. And that's what this is all about. And, everybody keeps, going back to COVID. Referring to a time period that I'm glad we are not in, a place that was very, very terrible for all of us. But Nicole did an incredible job. 07105, I know that number. because it was always in my head at all of the Monday meetings. They were 0705, 0705, and Kellen can tell you, and so can Malave in the back can tell you how we were like pulling no hair, and I have no hair, pulling it out, trying to figure out what we're going to do. And Nicole stepped up tremendously, which is why we recovered in the way that we recovered. Having vaccinations at bus stops, at street corners, was better than us driving to Kmart, because 50% of the people don't own a car in the city of Newark, and there was no way they were going to get to any of these places. So her work was life-saving work. And this is just an extension of that right here in this school, life-saving work to prevent people from long-term care in a hospital. They can get immediate care at a health clinic right down the street from where they live. So thank you. Thank you, RWJ. Thank you, everybody, for making this happen.
Thank you, Mayor. Our next speaker has been with us and one of our best supporters since the day we opened. I remember you standing at our first ribbon cutting. I remember before that when we were trying to get our funding to become a federally qualified health center. So I'd like to introduce you all to New Jersey Senate Majority Leader Teresa Ruiz.
Good morning, everyone. So clearly today, I think you see the equation for success in any venture that's going to protect our children and families, whether you're talking about in a community, a county, or just blocks. And we, the mayor, Nicole, everybody goes back to the era of COVID. And Eliana will probably share these stories too. County was running sites right across the street in the park. And one thing was very clear. When we initially set out to set our time frame, a lot of people were not coming out during those hours, and it was obvious. Those were the folks that were reporting for work and could not take a day off. And once we shifted and pivoted the time frame, people came out because they wanted to be healthy and get protected. And clearly, I think that same symbolic message stands for what these doors will do here, a one-stop shop for healthy communities. Yesterday, I was on the phone, and I'm terrible about this, and those who are close to me will attest that I wait until I'm not feeling great about being proactive about my health. And I have private insurance, right? And it is cumbersome, making a call, trying to get an appointment, visiting here, going back, the referral is wrong. Imagine if you're the single head of household who doesn't understand English, who doesn't have access to insurance, who perhaps you're calling the Ironbound your first home in America, and you're trying to get settled down. Now you know a school, which everyone feels that is a trustworthy venue to gain access to information that is factual and that is helpful, will be open so that our families, and let's be clear, 07105, the Ironbound, down here in the East Ward, there are generations of new Americans that continue to come to call this place home, who are underinsured in ways that perhaps we can never count. But now these doors will be open, not treating anyone with any kind of inequality, but saying, you're sick, we're going to provide you access to health care, and we're going to have a stronger and healthy community. The mayor was remiss to say Nicole and Raul, and I applaud them, but the mayor was full front and center during those COVID days. And I will tell you that in the midst of the fear and the angst that we had, I was so proud of having a leader who did things that people were upset about, shut down the city, didn't want anybody else because he was protecting my kids. He was protecting your kids. He was protecting everyone in the city. So a debt of gratitude to you, and we would be remiss if we didn't include you in the applause factor for making sure that the city of Newark was a champion and was a symbol of what should happen when there is a crisis at hand. To our superintendent, who recognizes that you don't need a designation to be a community school, that all of our schools function that way, because he has an army and a team that if a family walks in and need access to care, that they are there to connect them to resources as best as they can. Thank you for being a cog in the wheel that's making Newark a success. To the school board, thank you for opening your doors and welcoming this. Nicole, for really leading. This is my second FQHC event. I don't want to make you jealous. Event this week because we're celebrating federally qualified health centers, a critical need for areas that are in dire deserts of not having access to doctors. Newark still sits in that position. And if it were not for Barnabas, Clara, and Beth in particular, we would be a million times worse. And every single opportunity that they get to step into the fold and partner and be aggressive about it to support our families, they always come in and do it well. So thank you for your partnership with that. So to everyone here, I can't wait to see it in action. I can guarantee you that you're going to be busy all of the time. If anybody has visited the other one just nearly up the block, it is a place where, and it's not frequent, it's frequent flyers. It's people who are coming in and understanding the importance of coming back and revisiting and having, perhaps I should get trained in that. Because then sometimes I'm just sitting in a parking lot calling someone here saying, I need an appointment, I think I'm dying. Because it's a whole framework of education, and what a best place to start teaching the next generation and our families the importance of healthcare right in a school, right with a partnership, and right with everyone in this room. So congratulations.
Thank you, Senator. And post-COVID, FQHCs don't get jealous of each other in Newark anymore. We all work together, right, Ketlin? We collaborate and we work very well across the city. Actually, when I was starting St. James Health and we went to the mayor for support, he told us we could have 2 of these in every ward and we would still have patients not served. We would still have people that need health care. So the competition isn't there. We are able to collaborate and work across the city together. Our next speaker has been with us since day one also as a supporter and is probably our most local person coming up here. She lives down here in 07105. The New Jersey Assembly Budget Chair, Ileana Pintor-Marin.
So local that this is my backyard, literally 3 blocks away from here. Good morning, everyone, and it's really exciting to be here today. Just because you're right, Nicole, 07105. People sometimes think when you hear that zip code and you hear the Ironbound, people have a prejudgment at what everybody's status here is. But those of us that really live in this community understand that we're all over the place. And our needs are just as much as any other of the wards. They might be different, but they're just as high. So I'm so happy that Nicole has really established that partnership with RWJ. Mark, you're just really smart because you so happen to be able to corral smart people. It's not that you particularly are the one. It's just that everyone, Nicole, Valpreet, Chris, you just happen to have a really great team. No, all kidding aside, Mark, thank you very much for all of your partnership, because whatever it is that we do need from RWJ, it's very rare. I think at this point so far, you've never said no to us. And if you can't do it, you figure out how to do it. So thank you. But Nicole, you're also an extension of the East Ward. You live here, you've been here, your family has been here for so many years, so you know what it takes to really be able to do something. And Nicole, she even had reached out at one point when you were so busy with just St. James and you were looking for other locations. We partnered with Salvation Army that I see here as well. And we had the state come in to help to do vaccines as well for testing and all of that. So you really covered the plethora. But one of the things that I'm the most excited about is when those kids happen to walk by and they see a nurse or a doctor or a phlebotomist or whoever it is, those are also opportunities that our kids get to see that they normally wouldn't get to see. So they're going to be able to also be exposed, Roger, to different curriculum and different activities that are happening here at the school, which is what makes this so fabulous. So congratulations to Newark Public Schools. Mayor, everything that you have done for the city when it comes to COVID and vaccinations, and I know that at times, people were not very happy with you, with how stringent you were, but you did it because you cared about people, and you did it because you love this city, and you did it because you love the people here. So congratulations to all of us. Nicole, congratulations to St. James Health. Whatever it is that you need, you know that you always have a partner in us, so thank you very much.
Thank you so much. Our next speaker, as Mark mentioned, is our council president that's going to be heading to DC, and we're very excited to visit her down in DC as well. Council President LaMonica McIver.
Thank you so much. First of all, Nicole, I'm so grateful that Newark has a Nicole. She has been amazing. I know I always have to call her, Senator Ruiz, and say, look, I need to get in there. I'm about to die. Can someone let me in? And Malave, who's now there as well, I get to call him now too, to get in there. But seriously, your work, your leadership has been amazing, and we are just so grateful for you for all that you do. It's good to see all of the partners here making this happen. To our mayor for this vision. This is another extension of being able to bring healthcare right into the community, right to the streets, right to the local areas. And while we're in the East Ward today, we have the opportunity to celebrate Nicole's work throughout the city of Newark, and looking forward to the one coming in the Central Ward as well, coming online at Metropolitan and Willard. So we're doing this work each and every day. Many of you are involved in that, and you're there. And so I'm just excited about being able to expand and being able to bring healthcare right in our communities, and people don't have to travel, catch the bus, they don't have to get an Uber, worry about getting there. They can literally drop their kid off to school and come in and get a check the same time. And for me, that's very important for us. I, of course, I'm here on behalf of our council, which we all know Nicole's number, as well as Barnabas and everyone in this room who we bother each and every day for our constituents. And so on behalf of the council, and of course our East Ward Councilman Michael Silva, who is not here but still here in spirit, we are just super excited and delighted about this. So thank you to all of the partners, to our fabulous superintendent and our board president. Thank you for all that you do. And I cannot help but not to mention our amazing health director who is here, who is doing a fabulous job. The mayor talking about competition, definitely not her speed or her reputation. She is about collaboration. It is her middle name, collaboration. So we're excited about her leadership. So thank you all for this. And I'm definitely looking forward to going to DC and arguing and fighting and doing everything I can to bring more dollars back here to programs like this. Thank you.
Thank you. I mentioned today is part of National Health Center Week, and we are extremely lucky that we get some visitors from DC and from the city. We have Health and Human Services here with us. So our next speaker is Joseph Palm, the Regional Director of the U.S. Department of Health and Human Services for Region 2 and 7. Okay. I think he might be our furthest visitor. We had our closest visitor and then our furthest. You came in from St. Louis? Come on.
How you doing? Doing great. I want to congratulate you on this great opening. Listening to the mayor and every other elected official, and that you're right, COVID was a tough time. And as a firefighter, a former firefighter, I can tell you that I got to see it firsthand. And some of my relatives passed away. And I'm very thankful that the Biden-Harris administration from day one hit this, all right, it's all right. Hit the ground running. And we worked hard to deal with that. And I can tell you, we stand ready to do whatever we can to protect the people of the United States of America. I also want to say that as I was walking in, and it's a testament when you see all these people sitting here, that you all do great work. St. James, RWJ, Barnabas. But under the tents in the rain, the community health workers are outside, the doulas, okay? And I want to let you know that we've been trying to bring together the doulas, the community health workers, the peer support specialists. If you don't know about 988, it's a 3-digit number that's free that you can call 24 hours a day, 7 days a week if someone's having a mental health challenge. As you know, through COVID, coming out of COVID, we've seen an increase with mental health challenges. And people don't want to talk about it because of the stigma and that, but that number was created, and we are asking people to use that number. But I really just want to say it's about the people. Community Health Center Week is about the people. You are the heartbeat of the community. You get out in the community, you get it done, you touch the people that need to be touched, that many people have nowhere else to go but to the federally qualified health centers. So I want to thank people, the janitors, the people that work the front desk, the people that are never able to sit here and be a part of this. I want to thank you, because if it wasn't for you, we would not be able to be here. So as we move forward, I want you to know the Biden-Harris administration is committed to you, and we are committed to the people, and we are doing everything we can to improve your quality of life and improve the health outcomes. And thank you, Director of the Department of Health, for all that you do. Peace and love to you. God bless you.
Thank you so much, and thank you so much for coming out today. Our next speaker, Dennis Gonzalez, the Executive Officer of the U.S. Department of Health and Human Services, Region 2, has, again, been one of our supporters since day one. He's probably one of the first people I met when St. James opened, and he is one that comes out for the Primary Care Association. The Primary Care Association, every CEO from the state sits on the board, and we know if we have questions that we need answered from the federal level, Dennis is always there for all of us. Dennis, do you want to come up?
Good morning, everyone. You know, I'm proud and have the privilege to say that Joe is my boss as a regional director, and Joe's very humble, but you know, he represents Region 7, which is Kansas, Nebraska, Iowa, and Missouri. Region 2, which is New York, New Jersey, Puerto Rico, and the Virgin Islands. And before, he was also the regional director in Region 5, which is Illinois, Indiana, Michigan, Wisconsin, and Minnesota. But obviously, you know, he's human, so they had to take away Region 5 from him because he couldn't do half the country. You know, I remember 2008, that sad day when St. James Hospital closed. And I remember how it impacted, you know, the Iron Brown section, how it impacted actually the whole city of Newark. And then shortly thereafter, you know, I started to get phone calls from community leaders all over Newark, from then Mayor Corey, and then Acting Mayor Quintana, and then Mayor Barak. And all the community leaders who came to us seeking assistance, seeking help. We need health care in the Ironbound section. And we worked hard. It was not easy, and Nicole knows it was not easy, but we worked hard at the federal level in DC to create the St. James Community Health Center, which is a federally qualified health center. And the FQHC program at HHS is, and I've been with HHS 20 years, it is in my opinion, the best, and we have a lot of programs. We are the largest department in the federal government, so we are the biggest funder of different community and healthcare programs. But the FQHC program, in my opinion, is the best program at the federal level because it's through the FQHCs that we provide health care to people who otherwise wouldn't have access to health care. And, you know, not only do we help people who are underinsured and don't have insurance, but we also help through community health centers the undocumented, who definitely would not be able to get any health care if it wasn't for our community health centers. You know, the theme, this is Community Health Center Week, and as Nicole mentioned, and I saw Senator Weiss at an event earlier this week, I'm doing a lot of, along with Director Palm, we're doing a lot of events, both in New York and New Jersey. The theme for this year is Community Health Centers Empowering Communities. And there is nothing more empowering for a community than access to quality health care. And conversely, there is nothing more disempowering than a community that doesn't have access to health care. And so I want to thank St. James. I want to thank RWJ Barnabas. I want to thank the school district, our state partners, our council partners, of course, the mayor, the Department of Health, the City Department of Health, because it's through these partnerships that we're able to provide the services that are so badly, healthcare services that are so badly needed in these communities. So thank you all very much. Congratulations, Nicole, and all the best.
So, as I was opening St. James Health here in the Eastside High School, I have to fill out an application to the state. You two should probably cover your ears back there. This is our state. And I called somebody to ask for her application from her school-based site so I can copy off of it. And she sent it to me within 10 minutes and has been a great community partner. In my opinion, she's the best director the mayor has had in the health department. And I want to welcome her up here. I'm so glad she's here today.
Thank you for that, Nicole. So I grew up here in the West Ward of the great city of Newark, but I actually live here in the Ironbound section. I've been here for the last 15 years, and fun fact, my son graduated from Eastside High in 2013 and played football for the Eastside Raiders as well. I love this community, the people, the culture, the food, the music. It speaks to my own Caribbean heritage. And you know, being here, I appreciate the needs of the community that are currently being served through St. James and under the leadership of Nicole. As a health director, I'm constantly scanning our city to identify health disparities, underserved communities, and vulnerable populations, looking for opportunities to expand access to care and increase utilization of preventive care services that keeps us all healthy. But when it comes to the East Ward, I've always been able to take a sigh of relief and know that my fellow CEO, Nicole Fields, has got the East Ward covered. The services and the quality of care that's provided through St. James Health is why they've earned the badge for being a quality healthcare center and leader from our funders HRSA, a division under the U.S. Department of Health. This badge is given to health centers that are meeting or exceeding national benchmarks in one or more quality measures, everything from cancer screenings to diabetes and heart health. Again, this community is being well served by St. James, and as it seeks to expand its footprint throughout the community of the East Ward, our City Health Department will continue to serve as a partner by extending primary care access to public health services like lead screening and WIC. Just yesterday, Nicole and I were talking about a grant opportunity to implement a sickle cell disease treatment program. And I said, well, you know, I'm not sure. My numbers are kind of small. And she's like, yeah, I'm not sure. My numbers are kind of small. And we're like, you know what, let's take your little number and my little number and make a big number and do some things here in the city. That is the spirit of collaboration that fosters and promotes health and well-being in vibrant communities like what we have here in Newark. Today's ribbon-cutting ceremony amplifies the theme of this year's National Health Center Week of powering communities through caring connections. Creating medical spaces within a school setting is a brilliant way of connecting care to people. The students and the families of the Eastside High School and also the surrounding community that no longer needs to travel down to Lafayette to the main headquarters are going to be greatly served from this site. Thank you to our mayor. Under your leadership, building a culture of health here in the city has always been a top priority. Thank you to Robert Wood Johnson, Barnabas Health, for your support and investment, which has allowed FQHCs like mine and Nicole's to expand and bring new services that will otherwise not be funded, like Uber Health, like food pharmacy. Congratulations again to St. James Health, and thank you for your commitment to our great city and to this amazing community.
Thank you so much, Director. Our next person that is going to close this out is, as Mark said, my partner in crime that I speak to all day, every day at RWJ Barnabas Health, the Senior Vice President of Community Health, Balpreet Grewal-Virak.
Yeah, thank you. I appreciate that, Nicole. In fact, we spend so much time together that most people are starting to think we're sisters, which I take as a real compliment. I want to acknowledge all of our partners, but of course, especially Nicole Fields and all of her team at St. James Health who work tirelessly to provide the community with essential health services. So thank you for the partnership, Nicole, and of course, Raul Malave, wherever he is, for his hard work and dedication. I also want to thank our president and chief executive officer, Mark Manigan. Honestly, it's really through Mark's leadership and his commitment to addressing health equity and improving overall health of the community and communities we serve that makes it even possible to bring this vision of opening a health center inside a high school to life. So thank you, Mark, for your commitment and dedication to everything we're doing. Today's an exciting day for Eastside High School, the families who live in this community, of course, Mayor, the city of Newark. We are making high-quality health care more accessible to everyone in the Ironbound by bringing it right to where the people are, right here in the school. For many communities, the local public school is its heart and center. It's a place of trust where we forge lifelong relationships. It's where we send our kids each day to learn and where parents and grandparents come to meet their teachers or watch them shine on a stage or on the field. And now it's where they can all go see a doctor and get the health care they need to stay healthy and live fuller lives. But this health center is a part of a much larger initiative RWJ Barnabas Health is spearheading in collaboration with St. James Health and other health partners to transform the delivery of health care right here in New Jersey's largest city, Newark. The Our Healthy Newark initiative, funded through an appropriation by the state of New Jersey, and a huge shout out to our legislators and our electeds, and I'm looking at the three women that are sitting in front of me. It's everything you do in Trenton every single day that allows us to have the funds to do this type of programming. And of course, I'm not shy. I will absolutely come see you in DC if I have to do the same, especially in addressing health equity and the social determinants of health, which we've heard often today, in the most vulnerable communities and thereby improving health outcomes. So thank you. That includes making it easier to see a physician or a specialist right here in the school, improving access to care, fresh produce and healthy foods via food pharmacies and food hubs in Newark, affordable medication via 340B pharmacies, and transportation via our Uber Health partner, and of course safe housing, as well as other socioeconomic factors. The St. James Health Center at Eastside High School, in partnership with RWJ Barnabas Health, is just one piece of the puzzle that we're all working on together to solve so that our families are healthier, our communities are stronger, and our state, the state of New Jersey, is a better place to live. I really appreciate the collaboration. I appreciate everyone that came out today to help support. And Mayor, I hope we can do many more things in partnership with you and, of course, my friend Ketlin coming up in this city. So this will be one of hopefully many ribbon cutting ceremonies. Thank you for coming out today.